Hi, I'm Dr. Keith Berkle. I'm an OBGYN at Virginia Women's Center, and I'm with Dr. Carrilynn Sikes.
Hi, my name is Carrilynn Sikes. I am a pediatrician with Pediatric Associates PC.
One of the vaccines that's on the newer side is the HPV vaccine, and as an OBGYN, this is a vaccine that we at Virginia Women's Center offer as well. We obviously don't get into very many of the childhood vaccines, but we routinely offer the HPV vaccine, and we think that it's an important one to get. There are between 2 and 7 strains of HPV that cause 90% of cervical cancers worldwide, and so we think that protecting against it is very important. There's a study that suggests that if we were to vaccinate every 12-year-old girl against HPV, then we could eradicate not only about 3,000 to 4,000 cases of cervical cancer a year, but upwards of 100,000 abnormal pap smears a year. At Virginia Women's Center and in the OBGYN practice in general, we're not usually seeing 12-year-olds. But there's a wide range of ages for which we can protect against HPV. And so if your pediatrician did not give you an HPV vaccine, or if you decided against the HPV vaccine for your child, or your parent decided against it for you, but you're interested in it now, certainly talk to your gynecologist about it, because we're able to do that. Dr. Sikes, what's the conversation you have with your patients regarding HPV?
So that's a big conversation that has started more recently in the last, I would say, 5 to 7 years. The current recommendation actually from the state is for all, and starting for 2021, is for all children going into 7th grade to be vaccinated against the HPV virus. So the conversation that I have starts at an early age, and the conversation is one about preventing cancer. It's not necessarily that we are giving you this vaccine so that your child can become sexually active. That's not the point. The point is to protect people with vaccines prior to any exposure to that virus. And so really we are protecting against cervical cancer. And so we start that conversation usually at their 10 or 11-year-old visit. And usually we try to start the vaccine at their 11-year-old visit along with their middle school shots.
It's worth noting, as Dr. Sikes just mentioned, that the best time to provide the HPV vaccine is before someone's sexual debut, before the first time they become sexually active. We know that in the United States, about 67% of women aged 15 to 19 have engaged in intercourse, and a much larger percentage have engaged in other kinds of non-coital sexual activity. And so we think that all of those activities put someone at risk for HPV transmission. And so getting the protection on board as young as possible is important. We've also done some pretty significant research into whether or not the protection afforded by the HPV vaccine increases promiscuity, as Dr. Sikes alluded to, a lot of parents' concerns, and that data just doesn't bear out at all. What we know is that all giving a child the HPV vaccine does is protects her against HPV. It doesn't have any bearing at all on their likelihood to engage in sexual activity in the future.
I would also add that it is important to get your daughters vaccinated, but it is also important to get your sons vaccinated as well. So like I said earlier, the Virginia state recommendation going into 7th grade starting in 2021 will be that all females and males going into 7th grade will have started their HPV vaccine series. Because if we just vaccinate females, then we're not eradicating those strains of the virus that are known to cause cancer, and so while they cause cervical cancer, they also cause penile cancer as well.
Certainly receiving the HPV vaccine at a younger age carries more benefit and possibly confers more protection. But at any time, it's probably not too late for women who are at risk for cervical cancer to receive the HPV vaccine. At Virginia Women's Center, our doctors are capable of counseling our patients and providing that vaccination at whatever age you present. We are quite accustomed to doing pap smears and finding abnormal cells and managing them, and we do so quite well. But it would be A-OK if we didn't have to manage any abnormal pap smears any longer, and the HPV vaccine can help move us in that direction.
Brought to you by the MEDARVA Surgery Centers, conveniently located at Stony Point Surgery Center and West Creek Medical Park, providing highly personalized care and exceptional value in surgical services. Learn more at medarva.com.